Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering borderline personality disorder. If you haven't watched my other videos on the other personality disorders, be sure to watch them. You don't have to watch them in order, but be sure you cover them all. Why? Because you will be tested and you have to know the differences of these personality disorders if you're currently in the nursing program and you're taking psych. So there are certain things that are specific to each disorder that you should be able to pull out. So I encourage you to watch the other videos. Support my channel, please. Like this video. You know you're going to love it. Just go ahead, press that like button. If you haven't subscribed to my channel already, please be sure to subscribe to my channel. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com. And you guys can find me covering different types of questions almost daily on my other social media platforms, such as TikTok, Instagram, and Facebook. All right, guys, so let's get started. Let me make this a little bit bigger for you. Okay, Chantel, this is for you. You requested this video. I got you. Okay. Borderline personality disorder. Look at what it says. This falls under a cluster B. All right. Another cluster B diagnosis, borderline personality disorder, is the most well-known and dramatic. These are the drama king and queens. Dramatic of the personality disorders. Borderline personality disorder is characterized. Remember, I taught you when you're studying and you see that word classic or characterized or triad, or what's the word I'm looking for? Cornerstone. When you see words like that, whatever comes after it, it's important. Make sure you pay attention. Take a look, guys. It says that borderline personality disorder is characterized by severe impairments in functioning. The major features of this disorder is marked instability in emotional control or regulation, impulsivity, identity or self-image distortions, unstable mood, and unstable interpersonal relationships. This says a lot. So let me break this down to you. The person with this type of disorder, they are very impulsive and they love to have attention. So any tiny little thing, they will turn it into a big deal. These type of people, these type of patients, they cannot have long-lasting relationships. They self-sabotage. They even hurt themselves. Okay, let's keep going. One of the primary features of borderline personality disorder is emotional lability. 1 second they're happy, then they're crying, then they're happy again, then they're sad. It's like you're on a roller coaster. They have emotional lability that is rapidly moving from one emotional extreme to another. So they're either so happy, they're hugging you, they're kissing you, they love you so much, to they're crying, they hate you, you're the worst person in the world, like that. Okay. Another disruptive common trait in people with borderline personality disorder is impulsivity. They don't think before they act. The minute they feel something, they don't have any control over it. They act on it. Impulsivity is manifested in acting quickly in response to emotions without considering the consequences. Your husband says something to you that you don't like, it hurts your feelings. You may want to curse him out. You may want to slap him. You may want to act a fool. But what do? You think about it. You think about the consequences of that behavior. It might make things worse. So what do? You say, you know, honey, I don't like what you just said. Let's talk about it, right? You think about your consequences, about the consequences. They don't. They act on their emotions. Self-destructive behaviors are prominent in this disorder. Ineffective and often harmful self-soothing habits, such as what I'm about to go over, guys. This is important to know specifically for borderline. Cutting. When they feel pain, or they feel anger, or they feel frustration, patients with borderline personality disorder, we see this is very common, they will cut themselves. Okay, cutting. Promiscuous behavior. And on top of that, risky promiscuous behavior where they don't use protection. And numbing with substances. So they try to numb their emotions with drugs. Okay, so Addiction is often a comorbidity with this type of diagnosis. This is common and may result in unintentional death. Something that I didn't see here, but you need to know that for borderline personality, very often they will die accidentally. And here's what I mean by that. Remember, they're drama queens, they're drama kings. So let's say their girlfriend breaks up with them, right? And they want to do this elaborate gesture. They'll try to fake their suicide. So they don't really want to die, but they act like they want to die to get that person to come back. But what happens is often something goes wrong. Maybe they timed when the person was going to come back to the house and something held that person up and they didn't come back to the house in time to, you know, save them from hanging themselves or calling 911 because they ingested all of this medication and they end up dying. They weren't truly trying to kill themselves. They were trying to get the person's attention. Okay, one of the behaviors is manipulation. All right, I'll come back to this table in a second. By the way, for those wondering what book I'm teaching out of, this is the book. This is a wonderful book for psych. If you're struggling in psych, I encourage you to go ahead and pick this book up. Okay, borderline personality disorder is also characterized by feelings of antagonism, always having to argue. If I say red, you got to say blue. I say up, you got to say down. Manifested in hostility, anger, and irritability in relationships. Physical violence toward intimate partners and non-intimate partners alike may occur. Why? Because they're very impulsive. They don't think about their consequences. So as soon as they're thwarted, as soon as someone says something to them that they don't like, they don't think about the consequences. They just lash out. And very often they lash out physically. An unusual feature of this diagnosis is the use of splitting. You guys have to know what that word means. Splitting as a primary defense or coping style. Splitting refers to the inability to view both positive and negative aspects of others as part of a whole. So they're unable to do that. For example, my husband and I, we've been married almost 20 years. I love him. He's a wonderful person, but I understand he's human. So there are good sides, there are bad sides. I'm human. There are good sides, there are bad sides. Nobody's perfect. Guess what? This person, they don't see it that way. As long as you do what they want, you're wonderful, you're good, you're the best person on earth. But as soon as you block them from whatever it is that they want, you're the worst person in the world. You're horrible. You have no good qualities. That's splitting, and that's like a self-defense behavior for them. Okay, so you guys absolutely, definitely have to know this word. I've seen it a lot on NCLEX and on exits like HESI and ATI. So you definitely need to know this word. Look at the DSM-5 criteria for borderline personality disorder. So it's a pervasive pattern of instability in interpersonal relationships. And that makes sense, guys. You see what type of person we're dealing with. You think they're going to be able to have long-term interpersonal relationships? No. They have instability of self-image, affects. They're happy, they're sad, they're crying, and marked impulsivity beginning by early adulthood and present in a variety of contexts as indicated by 5. You guys see that? 5 or more of the following. So for them to be diagnosed with borderline personality disorder, we have to see at least 5. So let's go over this list. 1, frantic efforts to avoid real or imagined abandonment. So the example I gave you, so look what it says, do not include suicidal or self-mutation behavior that's covered in 5. All right, so example is they're in a relationship and their spouse decided that they want to take up yoga. They will freaking lose their mind because they're so scared that if that person starts yoga, they're going to meet somebody else and leave them. Okay, and they start acting the fool. 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes, because remember, guys, they have no middle ground. They're either at 0 or they're at 100. Okay, extremes of idealization and devaluation. 3, identity disturbances, markedly and persistently unstable self-image, or sense of self. When it boils down to it, they're very, 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 very insecure. Impulsivity in at least two areas that are potentially self-damaging. For example, spending, sex, substance abuse. Let me back up because I want you guys to understand what they mean when they say spending. Excessive and irresponsible spending, blowing all the money that you have, gambling away everything that you have, having sex indiscriminately, having risky behavior sex, substance abuse, reckless driving, binge eating. And again, do not include suicidal, excuse me, or self-mutilating behavior because that's covered in criterion 5. Here's criterion 5. Look what it says. Recurrent suicidal behavior. Gestures. When they say gestures, that means what I was talking to you about earlier, that they really weren't trying to kill themselves. They were just acting like they were trying to kill themselves so they could get the attention of the person that they want. And most often they do that when they feel like the person they're with is about to leave them. Remember, they're very insecure about being abandoned. Gestures or threats or self-mutilating behavior, such as cutting themselves. Very often what they'll do is they'll take a bottle of pills and they can time. They know when the boyfriend or girlfriend or whoever should be home. And so they'll time it so that they take the bottle of pills, they lie down on the bed, they got the empty bottle, they might sprinkle a couple of the pills on the bed to paint that picture so that when the person comes in, they freak out, call 911. It's this whole to-do, and now they feel guilty and they won't leave you, okay? 6, affective instability due to marked reactivity of mood, such as intense episodic dysphoria. They're so happy, they're like on cloud 9. Irritability or anxiety, usually lasting a few hours and only rarely more than a few days. They are all over the place. They are, emotionally speaking, they're a roller coaster. Chronic feelings of emptiness, and they never like to be alone. Inappropriate, intense anger or difficulty controlling anger, such as frequent displays of temper, constant anger, recurrent physical fights. And number 9, transient stress-related paranoid ideations or severe dissociative symptoms. Let's take a look at this assessment guidelines. There's a list of them. I'm going to go over the most important ones. You guys can read. Let me make this bigger for you. On your own, just pause it. One, assess for suicidal or violent thoughts towards others. If these are present, the patient will need immediate attention. Do not leave them alone. They need one-on-one. So the first thing you are going to do, remember the nursing process, guys, assessment, diagnosis, planning, intervention, evaluation. First is assessment. You need to ask them directly, are you having any thoughts of harming yourself or anyone else? As students, I see this all the time. You're scared to ask the patient directly because you think you're going to put the idea in their head. And that's not true. What happens is many people who have these thoughts, they would like help, but nobody's ever asked them directly. Okay, so you need to ask them directly. And if they say yes, you ask them, do you have a plan? And if they say yes, and they tell you they have a plan, for example, they tell you they plan on shooting themselves. Your next question is, do you have access to the gun? So ask them if they have any thoughts of harming themselves or others. Ask them what the plan is, and ask them, do they have access to whatever that vehicle of suicide is going to be? Make sure you do that. Look at this. It says table 24.3, signs and symptoms, nursing diagnoses and outcomes for borderline personality disorder. Signs and symptoms, again, being impulsive, not being able to control your actions, not even thinking about your actions, abrading, biting, cuts on body, hitting, ingestion of harmful substances, inhalation of harmful substances. Look at this, guys, insertion of object into body orifice, picking at wounds, scratches on body, self-inflicted burns. history of self-mutilation, again, being impulsive, intense and unstable relationships, dependency. Remember, they are very insecure about being alone. Dependency, excessive emotional responses, attention-seeking behavior, difficulty in relationships, manipulative, destructive behavior towards others and self. Subjective data that we would expect in a person with borderline personality disorder. History of, look at this keyword, guys, superficial suicide attempts. So they attempted to kill themselves, but instead of cutting the vein, they just made a little cut next to the vein, and they just lie down on the floor like they were dead or they were dying. Okay, superficial, not real attempts. History of heavy drinking. Remember, they use substances, including alcohol, to numb the pain that they're feeling or the anxiety. Recent graduate from a community college. Now, this is from this case study that we're looking at, but something you need to understand with borderline personality, we tend to see these manifestations in young adulthood, okay? Them stating that they feel empty inside, and because of that feeling of emptiness, that's what leads them to a lot of those self-mutilation, I'm so annoyed. If I had the time, I would get speech therapy, I promise you guys. Them feeling empty inside, that's what leads them to those self-mutilating behaviors. Calling the nurses angels of mercy. Remember that splitting behavior, you're all good or you're all bad. Requesting a new primary nurse because current nurse hates her. They do this a lot. You are the best nurse in the world until you don't give them what they want. All of a sudden, you're the worst nurse. You're abusing them. They'll accuse you of things, okay? When angry, they threaten to cut themselves. Why? That's a form of manipulation. They're trying to manipulate you to get you to do what they want. Asking for anti-anxiety medication several times on a shift. Remember, with this type of personality disorder, they tend to be dependent on chemicals. Look at this care plan that's continued. Objective data. What would we see? What is measurable? Cuts on wrists, ankles, labia. Calm on admission, but in parentheses, I wrote run hot / cold, because on admission, they may be very calm, and then they shock you because the next, hour, they're acting a fool on your floor. Sneaking alcohol into the unit, going into bed with a male patient. Remember, they have a lot of promiscuous behavior, breaking rules, restless, pacing with angry expression. So let's look at the outcome for manifestations. For the cuts on wrists, or ankles, labia, for those cuts, you're going to demonstrate the use of effective coping strategies. Because right now, when they're angry or they're frustrated, they don't know how to cope with those emotions. So they go to what? Cutting themselves. So you're going to demonstrate effective coping mechanisms and strategies. You're going to do patient safety. You want to make sure the patient's always safe. Teach them effective coping strategies. I said that already. One more thing I want to go over with you guys. Here we go. So table 24.2, dialogue with a patient with manipulative, aggressive, and impulsive traits. You want to use open-ended statements, maintain a non-judgmental attitude. That's very important. First of all, guys, when it comes to therapeutic communication, we always want to use open, what's the word I'm looking for? Open-ended questions. Why? We want that patient to we want that patient to express themselves, right? There are only a few situations where we're going to consistently use closed-ended questions, and that's For suicide, if you suspect that patient's suicidal, they want to harm themselves or others, you're going to use closed-ended questions such as, do you have thoughts of harming yourself or others? Another situation is abuse. If you suspect someone's being abused, you need to ask them directly, not in front of the person you suspect that's abusing them. Get them alone first and ask them, are you being hurt? Are you being harmed? Are you being injured by anyone, including that person? You ask them directly, yes or no. Third, history. If something's happening, you have a patient that has to be rushed into surgery and you need some answers now. You need to know, are you on any blood thinners? Yes or no, because you're not trying to have them bleed out on the operating table, right? When's the last time have you had any alcohol within the past 24 hours? That's important because, guys, you know what alcohol does as well. You don't want that patient bleeding out. You need to know, do you have any allergies? Yes or no. So those type of questions, assessment questions, you're going to ask them. Those are going to be closed-ended questions. But other than that, you want to ask open-ended questions. All right. Redirect patient to present problem or situation. Why? Because they're going to try to manipulate you. They did something, you're trying to address what they did, and they're going to want to talk about everybody else under the sun. You need to redirect them. Redirect patient to the present problem and situation. And when you do that, you're decreasing that manipulation that they're trying to do. Note increasing anxiety. You need to watch for clues if that patient's anxiety is increasing, such as what? Them pacing the floor, or them talking in a loud, aggressive manner, or them going like this. Matter of fact, let's go to table 24.1 to look at those clues. Right here. Them having a rigid posture, hyperactivity, them pacing, that's a big one. All right, let's keep going. Identify feelings and explore threat or anxiety. Let's talk about how you're feeling right now and let's get to the bottom of it. What is making you feel threatened and what is increasing your anxiety? You need to set limits. You need to have boundaries. Set limits on and expectations on the patient's behavior, and you have to do that at admission. You can't wait until the patient does something wrong for you to tell them that, okay, you broke a rule, here's the consequences. At admission, you tell them what the expectations are and what the consequences are if those expectations are broken, and you need to stick to it. And you have to set limits and make sure you control boundaries because they will try to overstep those boundaries. Focus on patient's responsibility and suggest alternative methods of coping with situation. Again, they don't have any coping mechanisms. That's why they're cutting themselves. That's why they're pretending like they're suicidal. And not to take suicide lightly because, you know, sometimes they are suicidal and they do follow through. But for the most part, the people with borderline personality disorder, they're gestures, but you have to teach them how to cope with their stress or anxiety. Show understanding and suggest other means of coping. When you feel your anxiety start to rise, you know, you have to get to know your patient, figure out what they like to do. If they like to draw, when they feel like their anxiety starts to rise, instead of lashing out physically, pull out your pen and your pad and start drawing. Identify results of impulsive behavior. Sit down, let's talk about this and explore those times that the patient has acted impulsively and what the outcome was. Help them to see that, you know what, every time I act on my impulse, it never ends well. Let me figure out another way. That's borderline personality disorder, guys. In a nutshell, that is your borderline personality disorder. Guys, I hope this video was helpful for you to understand the difference in borderline personality disorder versus our other disorders, such as the narcissistic, and so on. I promise I got more videos coming your way, so stay tuned. Please let me know in the comment section if there's anything you'd like to see me cover that I haven't covered already. Don't forget, I have audio lessons available for you on my website, nexusnursinginstitute.com, and you guys can catch me on my other social media platforms such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.